Thank you, Dr. Mahesh. Thank you, AIOS, for giving us this opportunity. So, slides, please. Yeah. So, to sum up the whole topic, I've just given law for doctors so that it mentions whatever Dr. Mahesh has said. So, what is medical negligence and why we should talk about medical negligence? Because when in medicine, when you treat a patient, not everybody gets cured. And what is the main reason for patients not getting cured? It seems mistakes from doctors is the main reason why people don't get cured. That is what some studies have shown, and that is the importance of medical negligence. Now, what is medical negligence? There are three aspects to it. One is there is a duty of care. That is, when a patient comes to you, a doctor has a duty to treat the patient. That is duty of care. And there is a duty of reasonable care. What care you have to give is what a reasonable or an average doctor can give or should give at that point of time. And the third thing is there should be a breach in duty of care. The doctor is not giving the care properly. And because of that breach in duty of care, there should be an injury. So that is when a damage occurs, and that is when you are liable for medical negligence. So when you have medical negligence, it can come under a lot of laws that we will tell later. So mistakes and negligence, so these are the common errors that are supposed, that doctors are supposed to make when medical negligence cases come. Okay. Now, what is standard of care? Now, you have a duty to care, you should know what is standard of care. Standard of care is, it's not that, you should be the best in the field. It's not like a big time cataract surgeon who will give 6/6 for all patients, but you should be among the average or a normal cataract surgeon of your peer group, and you should deliver that results. That is the meaning of duty of care or standard of care. It doesn't mean excellent standards or superlative standards. It means normal standards that are applicable to everyone. Now, what are the liabilities that a doctor has towards a patient if the medical negligence cases come? So when you have this, you can have liability under different headings. You can have civil liability, criminal liability, liability under tort, disciplinary action, res ipsa liquidator, and all that. So, see, you have done some, there is some wrong that has been done, there is some damage, there is some negligence. You should not think that, they can give case only under the Consumer Protection Act. You should not think that they can case only, patients have multiple options of giving cases against you, and Consumer Protection Act or consumer courts are easier to give, and that's why patients give cases to them. And and disciplinary action means through NMC, they can take action that you have not done properly. And res ipsa liquidator, sometimes the damage is so much, somebody does a surgery, they leave a scissors inside the patient. Now, the damage is obvious, the negligence is obvious. In that particular time, it is not the patient who has to prove negligence, but the doctor who has to say that, why this happened. So the onus of proof falls on the doctor rather than the patient in such situations. Now, the new Consumer Protection Act and the new, the laws have come. Now we have IPC, CRPC, and Indian Evidence Act being replaced by Indian acts. Amit Shah ji has already passed it in the parliament. It has got presidential assent, and the new laws will come in force by July 1st, 2024. So now the Indian Penal Code is called Bharatiya Nyaya Samhita. Okay. So there was a news that, now doctors are exempt from criminal liability. Now the main situation here is, what is the criminal liability that doctors have? This has been clearly mentioned in that particular case law, Suresh Gupta versus Government of NCT. Usually what doctors come under is 304A IPC, that is Death Due to Rash and Negligent Act. So as far as doctors are concerned, gross negligence should be proved so as to put criminal liability on them. It is not just negligence like any other person, there should be gross negligence. Now, this has been further reinforced in the Jacob Matthew case, where saying that, just being negligent doesn't amount to gross negligence. Gross negligence should be proved by in the presence of an expert, and the court should be convinced. Only then a criminal liability can be put on doctors. Now, what are the safeguards that the laws have against criminal liability against doctors? So, one is gross negligence. It is not just negligence. And second thing is, if it is a private complaint means a patient goes to a judge and say that something has gone wrong, and a judge calls the police or necessary authorities to take a case against whomever has done the offense, or through an FIR through a police. What happens is this gross negligence should be confirmed by a expert doctor or a competent doctor. Only then the police or judge are supposed to carry on with the investigation and take criminal negligence against the doctor. And these things are not applicable to people who are not doctors. So you see, this is some filters we have protecting us from criminal liability. Now, this is the basic thing. Now, the earlier law means till July, it will be Indian Penal Code. And now, after July, it is called Bharatiya Nyaya Samhita. So 304 AIPC, under which this negligence comes, is now 106 section of the Bharatiya Nyaya Samhita. According to the Bharatiya Nyaya Samhita, this 304 AIPC, where you get negligence or criminal liability, the punishment is 5 years imprisonment. Earlier it was 2 years imprisonment according to IPC 304A, but now the punishment for 304A violation is now increased to 5 years. And this criminal liability is applicable to all medical practitioners recognized by the NMC of 2019. This criminal liability is applicable to them. So for a registered medical practitioner, according to the new law, for a normal person it's 5 years. According to the new law, for a registered medical practitioner, this imprisonment has been reduced to 2 years, which was in the earlier 304A IPC, it was 2 years. Now in the new Bharatiya Nyaya Samhita, this criminal liability under 304A IPC has been increased to 5 years of imprisonment. But for doctors, this 5 years has been reduced to 2 years in the Bharatiya Nyaya Samhita. So that is the only leniency that doctors have got. It is not that according to the new law, doctors are exempt from criminal liability, and there is a mandatory fine also along with that, along with this punishment. So these are the liabilities. 304A means death due to rash and negligent act. 337, 338 means grievous hurt or hurt due to rash and negligent act. And these are the defenses. One thing you should always remember is, just because you have taken a consent from the patient, it doesn't mean that you are exempt from any liability. Consent, good faith, all these things are only defenses that you can put forward when a case comes against you. It is not that since patient has consented, he has consented to your being negligent. That is not true. So this is, and always courts have favored, in a way, doctors only, saying that, a perfect result cannot be always got in a particular disease, and doctors are not gods. So it is like a reasonable care, and there should be, there should not be any negligence. That's all the court will look into. And this is what I said: redressal, civil and criminal courts, and Consumer Protection Act, NMC, and permanent log adalat also you can give. Say there's something called this permanent log adalat, Consumer Protection Act. All these things are quasi-judicial bodies. Importance of quasi-judicial bodies is, if you're going through the normal route, it takes a long time. These quasi-judicial bodies are there for speedy redressal of problems of the consumers. So this permanent log adalat means it pertains to cases in public utility services, and compensation up to 1 crore can be awarded by the permanent log adalat. So they can even give a case in the permanent log adalat. But usually they give a case in the consumer protection courts because of many reasons. I'll just tell you. And the famous IMA versus VP Shanta case, medical profession has been brought under the Consumer Protection Act, and the Consumer Protection Act of 2019 covers medical negligence. See, initially there was a confusion that in 2019 CPA, medical negligence is not mentioned. Usually when a law has to exempt something, it has to be explicitly be mentioned that these things don't come under the ambit of law. If it is not mentioned, it doesn't mean that it doesn't come under the ambit of this CPA. So at present, medical negligence comes under the CPA, or Consumer Protection Act of 2019, and it covers medical negligence. Now, the liabilities, if you look at the Consumer Protection Act, you have 3 levels. One is the District Commission, next is the State Commission, and another one is the National Commission. There is something called the pecuniary jurisdiction. How much of liability that the doctor has to pay or whatever, depending on that, the cases can go either to the District Commission or the State Commission or National Commission. You know that up to 50 lakhs, District, up to 2 crores, State, and more than 2 crores is the National Commission. Now, what are the nuances of the Consumer Protection Act? See, if Consumer Protection Act of 2019, there are a lot of pitfalls which actually goes against the doctors. Initially, IMA and all that, when they were fighting cases, they used to say that, medical negligence doesn't come under the Consumer Protection Act of 2019. But now it has been clarified, and I know, it is also a service. You gives a service to the patient, and patient pays you money. So it comes under service of the Consumer Protection Act. So doctors are in the ambit of the Consumer Protection Act of 2019. Then the second important thing is limitation period. There is something called as cause of action. Cause of action means the time at which the reason for the injury actually started. So whenever a consumer has to give a case, it has to be done, as far as medical negligence, it will be done within 3 years of the cause of action. But usually it is not the case, because if the court is convinced that this person could not give a case because of various reasons within that particular period, then the court will allow. So it's very important that you keep your documents. They can give a case even after 10 years or 15 years if the court allows and sees appropriate. So that is very important. And the third thing is, it is discretion of the judges. Judges are all human beings. And as you know, consumer courts are for the consumers. It is not for the doctors. So they will always favor consumers as far as these things are concerned. Now, another thing is, you have to file a reply within 30 days and maximum up to 45 days. If it goes beyond that, then you don't have a chance to fight against, or it should be, the case will be decided ex parte. Ex parte means the court will decide the case without hearing your part of the controversy. Then another nuance here is, if there is an award, and if you have to go to the next level, appeals are possible only after you pay 50% of the awarded amount. Initially, it was not like that. And the third thing is, now the filing has become very simple. You can file online also anywhere in India. Suppose in Calcutta, you treat a patient from Chennai, and he gives a case he can give a case against you, not here, he can give a case against you in Chennai Consumer Court. So you have to go to Chennai every time to fight the case. So that is also something. And the main thing is, just to file a case in the consumer protection courts, the court fee is very less. If you have a claim of more than 2 crore, you have to just pay 5,000 rupees as court fee. That is enough to give a case against you. So that is why everyone runs to the Consumer Protection Act, because if in the civil code you have to pay 10% of the damages, like that'll be a huge amount that the complainant has to pay. But here the fee is very less, and that's why they give cases against us in the consumer protection courts. Now we have all the schemes like professional protection scheme, professional indemnity scheme. The professional protection scheme is run by the IMA. It is a protection scheme. See, indemnity scheme is, it's just like an insurance. Like they'll say, okay, if you have a case, we'll give you this much money. And within that money, you have to find your lawyer, you have to fight your case. But professional protection scheme of IMA is not like that. Here what happens is, like they give you lawyer support, they give you professional advice, and here it is for justice and not for settlement. See, if they find that, like if you want to go for an appeal, they will fight for that also. You can go up to the Supreme Court. If they find that a small compensation has been awarded, but justice is not served, means they will again fight the case. They will not try to settle it. But in professional indemnity, it is not like that. They will try to settle it at the lowest amount and leave it. And this professional indemnity schemes usually don't cover criminal cases. In the professional protection scheme, it covers even criminal cases also. So I should urge everyone to be a part of the professional protection scheme of the IMA. It is available for individual doctors and even for hospitals. And for a claim up to 1 crore, the premium per year is maybe 10,000 or 12,000. So it is not very high amount. And because it's a doctor's organization, settlements are very prompt and easy. And these are the defenses that a doctor can put forward, like known complications, difference of opinion, these are all things, I mean, these are not, blanket protection, but these are all defenses that the doctor can put in case he has got a negligence case. So this is one thing, and I'll just tell you about what happens actually in a medical negligence. Suppose a patient feels you have not been treated properly. The doctor has been negligent. First thing is, he'll send you a legal notice, saying that, if you don't pay me this much money within this much amount, I'll be forced to go to the court, etc., etc. Now, the important thing is, you should reply to that legal notice through a lawyer. Many times, if you give a very, very good reply, that case gets settled there and there itself. You should not say that I don't agree, you get lost. No, that is not the reply. With facts and all the other things, you should give a reply, because not giving a legal reply means it is bad for you when the case goes to court. Second thing is, now you have replied to the legal notice, and the patient wants to go against you. He will approach the consumer forum. Now the consumer forum will look at the merits of the case, and if they take up the case, they will send you something called as a summons. It will come to you by post. Now you have to read the summons, and you have to give a reply within 30 days. And maximum up to 45 days are given to the doctor to reply. Suppose, you don't give a reply within 45 days, you lose your chance to reply. Your part will not be heard. So the most important thing is, as far as lawyers are concerned, they are not bothered. They don't have time for you. So it is up to you to run behind them and give the reply. Now, once you give the reply, there is something called as, they will give a reply to that, refuting your claims. And the case will go to the court. There will be hearings. There will be evidence, inquisitories, etc., etc. And there will be a final hearing when everything will be heard and the judgment will be passed. One important thing in the National Commission, which is different from our other places, is that, in National Commission, everything is like online. I mean, it is all written only. They don't go for the doctors don't have to go to the court for, evidence giving or cross-examination. Nothing like that happens. Everything is through writing and only documents. And maybe for the final hearing, you can go and just sit there, but the actual cross-examination that occurs in a case, that doesn't occur as far as the National Commission is concerned. So I think time is, how much time do you have? 5 more minutes. You can get the next presentation. Now, this is one important topic. This is called as doctor-lawyer interaction in a medical legal case. So, this is what is happening. Now, first thing you should understand is lawyers don't come under the Consumer Protection Act. Just because the lawyer has not run your case properly, you cannot give a consumer protection case against him. They are not like you. So, it is very important that you should go behind them if you want to get your case sorted out. Okay. So the most important thing is be vigilant, don't be dormant. This is the Latin saying, vigilantibus non dormantibus. It means be vigilant, don't be dormant. So basic thing is you try to avoid an interaction with a lawyer. That is the basic thing. So you take all precautions to avoid a medical legal case, and the most important thing is proper communication. Then this is what I told you about legal notice. This is what a legal notice means. Now, after this thing, see what happens usually, you will go to the lawyer who's most friendly to you. That lawyer's daughter would have had a foreign body in the eye. He will call you at 11 o'clock in the night. Then you will say, you bring her immediately, I will see her. And you will see. And when you get a legal notice, you will call the lawyer at around 10 o'clock. Then the lawyer will say, doctor, actually, I don't have time right now. You call me at 9 o'clock in the evening. Then we will talk. Then your heart will break because you have been so much kind to him. He has come, you have, obliged to him all the time, but he is talking like that. But you should not think like that because that is how lawyers work. And the most important thing is, in the initial thing only, you should get the best lawyer. What happens is, when it goes for an appeal, appeal is is decided on the matter of law and not on the matter of fact. Whatever you have not filed in the beginning, or whatever arguments you have not kept in the beginning, you cannot bring in a new thing for the appeal. So most important thing is, the first time only should be the best shot. First shot should be the best shot, and this principle is called constructive res judicata. And another important thing is lawyers don't know anything about medicine. So you have to sit and teach, and whatever reply you only have to sit and write. And you give it to the lawyer, he will convert to the legal form. You should not think that it is like doctors, they come and sit in front of you, you have to do everything. As far as a medical legal case is concerned, and as a doctor, you should do all the work, and the lawyer is only a medium to represent you in court. Okay, this is Krishnamar case, ROP screening. Actually, at that point of time, there was no ROP protocol at all. And it is said that such a big award for ROP was given just because he was not properly represented in the first time. And a detailed reply, take your time, and be very emotional, don't be objective, and discuss with your lawyer, do everything properly. And another important thing is lawyers are always busy. Whenever you have a doubt, you will call the lawyer, he will not pick up the phone. So in the lawyer office, there will be one person who is jobless, whom you can have access. You catch hold of him and maintain a communication with him so that, whatever you want to convey, you can convey through him. That is one important point. Then a response within 30 days. These are all laws, relevant documents. And important thing is you should attend all hearings on time. Because after 3 hearings, if you don't go, arrest warrant will come to your house. They'll force your attendance. And if you don't go the first time and you go the second time, what usually the judge will do is he will ask you to stand there. And your case will be called last as a punishment for not coming in the previous time. So most important thing is, whenever a summons you get to the court, you immediately go. Don't postpone it. And be truthful and pay your fees on time. Because even Harish Salve said, I charge a reasonable fee, which is fairly high by standard. So lawyer fees you have to pay properly. Thank you very much, and I've got few cases also. I think we are running out of time. So this is the basis of how you go about a medical legal case and how you should interact with your lawyer. Thank you very much.
Thank you, Ashok. Probably we can have 1 or 2 questions also because a lot of people may have their own experience. This couple of things I am reiterating. The initial reply to the notice from or the notice from the patient should be very concrete without divulging too much of information. For example, I will tell you one, I have treated VKH syndrome with angiographic diagnosis of VKH. and perfect. Patient had extremity RD, hand movements and 1 meter vision, became 6'6" with steroids and all the immunosuppressives and all. So after 6 months, he gave a notice to me saying that after my tablets, he got white patches in the skin. It is vitiligo, right? So it is associated in VKH. So the first reply itself, I was extremely strong. I gave a strong reply. It didn't even go to the court because a common sense man will not do this. So that is one. And the Krishnakumar versus State of Tamil Nadu, Dr. Ashok already mentioned. In 1996, there was no guidelines or standard of care for ROP, right? Still, that case was lost miserably, and it was against the government of Tamil Nadu. Actually, government of Tamil Nadu had to give a big amount. So it was lost miserably due to poor representation and poor proceedings in the initial stage. Most probably, nobody might have even gone to the court from the government to represent or give all the evidences. So that is the importance. So when you hit, you have to hit hard in the initial stage itself, and then proceed with. So next, thank you, Dr. Ashok. Any questions? We can. Vicarious liabilities.
Yeah, vicarious liability is very important because, you work in a hospital. I mean, the patient accuses you of medical negligence. The patient knows that you are a poor doctor. You can only give this much. So what he'll do, he will add the managing director's name and hospital's name also. If it is like that, he can get more compensation. And vicarious liability is an established principle in tort. Like a master is liable for the mistake of his servant. So that is something that holds as far as medical negligence is concerned.
Tort is civil law. Tort is civil law. And consumer protection, all these things comes under civil only, not criminal. So, like this case, this Krishnamar versus State of Tamil Nadu, 1.38 crores, it was divided actually. The government of Tamil Nadu will give this much, the superintendent of the hospital will give, that is Egmore, pediatric, women and child hospital will give. And then the unit chief or the head of the department will give this much, and last the attending doctor. So it was divided at 1.38 crores. So these are all things that happens when you don't defend yourself so strongly in the initial stage itself.